We are doing a socket preservation here on tooth number 30 right here. You can see here, like tooth number 30 here, that's the tooth. So we already removed the tooth, and we already went over the basic extraction technique. So we are just going to go over how we are going to do the socket preservation. So this is the x-ray. The tooth has already been extracted, so I'm going to go into the mouth to show you exactly how to do the socket preservation. So the goal is to do an atraumatic extraction. So number 30 is extracted, but you guys can see the flap is all the way up right here, and the totally atraumatic extraction. I don't know whether you guys can see the bone very clearly or not here. See, we didn't take any bone away or anything. The bone is all the way up here. The bone is all the way. I know it's a little bloody. Yes, okay. So the bone is all the way up here. So now we are ready to do the socket preservation. So this is a Copia's Zimmer membrane I'm going to use, and I can tell you I have used multiple membranes in the last about 20 years, and this is one of the membranes. I love it. It's just the best, and we have 3 doctors in our practice. We all use it, and this is one of the membranes we like it the best, and I'm going to show you. So I've already taken the membrane out of the pack. So now I'm going to open the membrane. So the membrane is going to look like this. And if necessary, you can cut and trim, took it out. And this is the membrane here. So if necessary, if your socket is smaller, so you can always cut and trim to the size that you want. Okay. I have the membrane in my hand here. And I'm going to keep my scissors handy just here, just in case if I have to trim the membrane. So now I'm going to go suction please. And I'm going to put the membrane. If you guys, I don't know how well, I know it's kind of hard for you guys to see. I'm going to slide the membrane in between. This is the buccal flap here. So what I did was I already relieved the buccal flap all the way down here. So make sure that whenever you guys are working on a premolar, you're careful about the nerve, but you can relieve it as much as you want, and you want to relieve it on the buccal, as well as you want to relieve the membrane on the lingual, the flap on the lingual, because you need to be able to slide the membrane on the lingual also. Okay, so once you relieve the membrane on the buccal as well as the lingual, then now you slide the membrane here on the buccal. And then now after this, like now you want to make sure that you have leaving the membrane here on the buccal, but like hold it all the way to the lingual to the degree that you are able to slide it under the lingual flap here. Can you guys see it okay? Yeah. Okay. So now the next step will be to put the bone graft and then slide the membrane to the lingual and then close it. Okay. I will just look at it already. So you guys already saw me putting in the membrane there. So now I'm ready for the bone grafts. Now we are going to be using the Puros cancellous particulate allograft, and it comes in a vial like this, and this is what I have here. Okay, so what I'm going to do is I'm going to put this in a dappen dish, and I'm going to show you how to mix it. And I'm going to dappen dish ready, and I'm going to pour the bone here. So make sure that how much ever bone you guys are going to need, and pick the particular the vial that it comes in different sizes, I believe 0.5, 1 and 2 cc. So talk to your rep and see which size you really want. So I'm going to pour the bone here. After I pour this, and I'm going to keep the rest of the bone if needed for finishing up the procedure. So what I'm going to do is, because this case I'm doing it under IV, I'm going to draw some saline from the bag, and I'm going to use that to hydrate the bone. So all you got to do is Get your dappen dish, and it's a clean and sterile dappen dish. And I'm going to put the water here. And we call this as a boozer. It's a boozer elevator. But any boozer, or I'm sure you guys have like a mold Periodontist elevator. The mold Periodontist elevator is going to work also. All you got to do is like mix it like this. After you mix it, you get a 4x4, which we have here, which is a glass piece here. After you mix it, you gotta just get the water out of the way. So 4x4, just get the, I call it wicking the water out. So to wick the water out, and you don't want it too dry and you don't want it like too watery. So that's why you kind of like want to get like a medium. And as you do more of this, you will get to know the consistency that you really like, and you will find a way to get around this. We'll start from here. Okay. So I call this as a pour and pack technique. You know, it's almost kind of you're pouring the bone and packing it really, right? So you have your assistant hold it, and if you have a very good assistant, and sometimes they can really like help you with even feeding the bone, and because like I have the because it's going to be like a lot of retraction needed. One assistant is not able to do everything that we need, so I'm going to have the other assistant just hold it right here, and I'm going to put the bone here. So remember the packing. So you actually go ahead and get the bone and pack it here. Feed me here on the bone, right here. Feed me here, okay? Go ahead and get the bone and feed here. So come, bring closer, okay? Bring closer, okay? See here, that's what I call it as a feeding the bone. Your assistants can feeding the bone. Malia is a great assistant. She's feeding the bone here for me. Malia did a great job on feeding the bone. So she pretty much fed all the bone to me here. So you can see the whole thing is filled with bone here. So now the next step will be to wrap the membrane up to the lingual and finish up with the procedure. See here? The membrane is here. So what I'm going to do is now I'm going to wrap the membrane to the lingual flap here. So do yourself a favor, guys. So make sure that you're going to retract the lingual flap here. Okay. And this is what I was talking about. This is one of the greatest membranes. And a lot of membranes will tear. Like whenever you're trying to slide the membrane. See here, this is almost absolutely no tearing at all. Anytime you guys are looking for any good membrane or any good bone, you're looking for the handling characteristics, and this is one of the best membranes I ever used. And the moment I tried the bone, I wrote back to the Zimmer guys and I said I fell in love with the Copias membrane. That's exactly what I told them. Absolutely, I really fell in love just for the fact. One of the main facts, like it has the best handling characteristics and it does not tear. Because if you are going to pick a membrane that's just going to tear as you are trying to get these procedures done, you're going to get really frustrated. So now you can see the membrane is all tucked under, like on the buccal as well as on the lingual. Now the next step will be to try and close the area with some sutures, okay? So you guys have the option either to use a Vicryl, which is the synthetic, and I do not see the name here. It's a polyglycolic acid. This is the brand you can buy, and I'll show you the box if you guys need it, or I'll put it like on the slideshow. And this is a chromic. Either you can buy a chromic or a Vicryl, but I'm going to use the chromic here. So sometimes you need some suction. You can see like you're ready to suture, but you really can't see. So suture, this is your mold elevator, the Periodontist elevator. So put it on there and then have your assistant go over this, because if you let them suction it right over the membrane, the assistant is gonna suck the membrane out, or you're gonna make your life difficult. So put your retractor over there on the top and have your assistant suction over it, so they're not going to suction the membrane. Now I'm ready for the suturing. So I took my 3O chromic out here. So I'm gonna go from the buckle. I'm gonna go out from the buckle. I'm gonna come out, and now I'm going to go to the lingual. I'm gonna come out of the lingual. Okay, now I come out, and it is an interrupted suture here, because I went like one tooth on the front as well as on the back. I got a lot of room I can just use to get a primary closure. So one of the greatest things with the copious membrane is you can actually leave it open, and you don't have to have like a complete primary closure. You're still going to be fine. Okay, cut please. Okay, and you guys can see here, this is like you can see the primary closure. I got a very good primary closure, and now I'm just going to finish up with a few more sutures, and then I'll show you after I am done. Yeah. So we pretty much closed it. Like you can see, as I said earlier, we had the luxury of going one tooth over on the mesial and one tooth on the distal, and particularly for demonstration purposes, we just reflected just a little bit wider than what we actually required. But definitely I would recommend, particularly when you guys are first starting, just go one tooth mesial or 1.5 tooth mesial and one to 1.5 tooth distal. And then after you do that, and uh, clean flap, atraumatic extraction, and put the membrane buckle to the lingual, and do the pour and packing. Make sure you have a great assistant like Maria and the other team that we have here. And we are running over, we are running short of hands because we are also doing the recording here too. But make sure that you're going to do all the procedures I said. And then after doing all of this, you can still see there is a little bit of exposure on the membrane. If I really wanted to, I can relieve it, and I can totally primary closure. I can get a primary closure, but it's just not required. So you can see a little bit of exposure you may or may not be able to see, but it's not critical that you need to get a primary closure. Particularly on an upper molar, you won't be able to get a primary closure. So all nicely sutures, ready to go. And we had a great patient here, and he was sedated, but he was coming out of the sedation towards the end. And I even told him, I was joking with him, hey, we have a textbook perfect procedures we did today, and you guys are all set. Okay.